under the influence of cocaine.
Cocaine is a fast-acting stimulant that floods the brain with dopamine, the chemical responsible for pleasure and reward. It creates an intense, short-lived high that leaves the user craving more. Over time, this constant cycle of rush and crash destroys both mental and physical health. When cocaine enters the body, it blocks the brain's ability to recycle dopamine. This flood of dopamine creates euphoria and energy, but once it wears off, depression and exhaustion hit hard. Long-term use damages the brain's ability to regulate mood, causing paranoia, aggression, and cognitive decline. Cocaine forces the heart to work overtime. Blood vessels tighten, blood pressure rises, and oxygen supply drops. These effects dramatically increase the risk of heart attack, irregular heartbeat, or sudden cardiac arrest, even in young, healthy users. Snorting cocaine damages nasal tissue and can cause chronic sinus infections or nosebleeds. Smoking it irritates the lungs, leading to coughing, chest pain, and lung infections. In high doses, cocaine can cause the lungs to fail altogether. The liver works to process and remove cocaine, but repeated use leads to inflammation and toxicity. When used alongside alcohol, the two substances combine to form cocaethylene, a compound even more toxic than cocaine itself, which greatly increases the risk of liver failure. Cocaine's effect on blood pressure and dehydration can damage the kidneys. In severe cases, it causes rhabdomyolysis, the breakdown of muscle tissue that floods the kidneys with harmful waste products. Cocaine constricts blood vessels and thickens the blood. This increases the risk of stroke, blood clots, and tissue death. Over time, the smallest blood vessels are destroyed, cutting off oxygen to vital organs. Cocaine weakens the immune system and slows the body's natural healing response. Users are more prone to infections and illness, and long-term use reduces the body's resilience to stress and disease. The drug overstimulates the nervous system, leading to restlessness, tremors, and insomnia. High doses can cause seizures, confusion, or even coma. Over time, the nervous system becomes unstable and permanently damaged. Cocaine increases muscle tension and strain, sometimes leading to painful spasms. In severe cases, muscle tissue breaks down, releasing toxins that damage the kidneys. Cocaine reduces blood flow to the stomach and intestines, causing nausea, cramps, and poor digestion. Long-term use often leads to extreme weight loss and malnutrition. Cocaine restricts blood flow to the skin, causing dryness, sores, and premature aging. Paranoia and itching can lead to skin picking and infection. Cocaine reduces libido and sexual function. During pregnancy, it can cause miscarriage, stillbirth, and developmental problems for the baby. Cocaine gives minutes of euphoria and can take your life in seconds. Just one line can trigger a heart attack or stroke. Do you need help with your addiction? You don't have to face it alone. At UKAT, we provide confidential advice, expert treatment, and 24/7 support to help you take back control of your life. Call us today on 08081 633227 or visit www.ukat.co.uk. Recovery starts with one conversation.